Hi, I'm Nicole Aaronson. I'm a pediatric otolaryngologist, also known as an ear, nose, and throat surgeon, and I'd like to talk to you today about ear and nose foreign bodies. So how do foreign bodies get in kids' ears and noses? 99% of the time they get there because the kids put them there, either because they're curious or because they're hiding something or just because. And so sometimes that's witnessed, mom or dad or brother or sister sees it happen, and sometimes it's unwitnessed. Sometimes when it's unwitnessed, the child will come report it pretty quickly, or sometimes it can go unnoticed for a little bit of time. So for the most part, ear and nasal foreign bodies aren't necessarily dangerous. If an ear foreign body goes in and the child doesn't complain and it goes unnoticed until a pediatrician's appointment 6 months later, for the most part, nothing bad has happened. That happens all the time, that we discover beads or googly eyes or earring backs or other things sitting in ear canals without any damage being done. Sometimes the child will feel uncomfortable and so will report it more quickly, and that can happen in the case of perhaps something like a popcorn kernel that tends to swell a little bit with any moisture and can create a little bit of pressure and discomfort. Nasal foreign bodies, when they're noticed right away, can be removed sometimes in the office, sometimes asleep, but when they go unnoticed for a while, if they don't come out on their own, they tend to have symptoms like unilateral, one-sided nasal drainage, which can be very foul smelling and somewhat purulent. And so I've had a number of patients come to the office for kind of unilateral, gross nasal drainage that will get better with a course of antibiotics, but always comes back. And I found things like cotton balls and hairballs and other foreign and dollar bills and other foreign bodies that have been in there for some time. The foreign body that is really a concern and needs to be addressed immediately is the button battery. So button batteries, unfortunately, are in lots of kids' toys and in lots of electronics and equipment around the house. And so kids can sometimes get their hands on them and put them in ears or noses. And because of the reaction from the kind of battery, it's not really acid, but we call it battery acid, can cause a reaction within the tissues that can be destructive to the tissues themselves. And so that is something that has to be emergently removed. So what do I do when a kid comes to my office with an ear or nose foreign body? So for the most part, I'll try to take it out, sort of depending upon the child and where it is and what it is. So if it's a small clump of construction paper in an ear canal, that's probably pretty easy to get out. If it's a really swollen popcorn kernel, a tolerant child might let me take it out. Another child might not. Usually I'll make kind of 1 or 2 good faith attempts to get it out. If the child is tolerating that, and if it's unsuccessful, we'll plan to do it asleep. It really does depend kind of on the child and their tolerance level. I've had 2-year-olds let me take beads out of their nose, and I've had 11-year-olds not let me take a peanut out of their nose. So it's very child and foreign body dependent. Most foreign bodies will not show up on an x-ray. I did recently have a young man who put the tab from a soda can up his nose, and that probably would have shown up on an x-ray, but he also pretty accurately reported what he'd done, so there was not necessarily a need for one. The procedure to remove a foreign body in the operating room tends to be quite short. Sometimes in the nose, we need a long telescope to look farther back if it's farther back in the nose. In the ear, it's usually a relatively quick removal using the microscope that we would use to place ear tubes. So in short, ear and nose foreign bodies are not necessarily terribly concerning unless they're a battery. If they're found in the short term, they usually have relatively minimal symptoms. If they are found longer out in their nasal foreign bodies, you might see symptoms like unilateral foul nasal drainage. If you are noticing drainage that's unilateral in a small child, a foreign body should always be something that's considered. Thank you so much for listening. If you enjoy these videos, please subscribe to Dr. Nicole Knows.